The healthcare sector is crucial for keeping people healthy and plays a big role in the world's economy. The 7th edition of ET Now Best Healthcare Brands delves deeper into the world of healthcare. A flagship event that brings healthcare experts together, held recently in the national capital.
The healthcare sector today is a very fundamental part of our society, offering the best of medical care and at the same time bringing to us a broad range of services, those that are comprised of diagnosis, treatment, rehabilitation, and of course, patient care. It is time for us to appreciate doctors, nurses, technicians, and those who work behind the scenes in creating a better life, in creating quality of life, and talking about a significant growth that we've seen in the last decade or so. With the ongoing innovation, we have so much to do. With the way we're all collaborating, we have so much to achieve. And as we move on with these milestones and more, it is time for us to appreciate you and your peers from the industry.
The event was flagged off by Dr. Girish Tyagi, Secretary, Delhi Medical Council.
In 100 cases, 80 cases will be a plain headache which can be resolved by giving a paracetamol only, or by giving if the patient adequately got a sleep in the night. But Dr. Wright CT scan or investigations in the CT scan, if the CT scan becomes normal, comes to the normal, they thought the doctor is writing CT scan for the commission or anything like that. So treatment becomes costly, doctors becomes using the defensive medicine for that matter. And nowadays when you see that in one of the case, Kunal Saha case, few years back, there was a compensation given to the tune of 11 crores. So once the doctors automatically starting using the defensive medicine for that matter. And D is the doctor-patient relationship, and D is the involvement in the decision making. So doctor-patient relationship, in a few years back, it was supposed to be a pious relationship based on faith and trust. Now the faith is not there, trust is not there, that pious relationship is automatically gone. So it is totally a consumer and a service provider relationship. The patient feel that, or the relative feel that once they are paying to the doctor, it is the duty of the doctor to treat them and so that. And D also stands for decision making. Nowadays, if the doctors or the hospital are not involving patient in the decision making, so let the patient or the relatives be part of the decision making, what you are doing to the procedure, what the procedure is giving, what or operation is being done, they should involve in the decision making. So if the doctors are involving the patient in the decision making, likelihood that the patient then complaint will be reduced. E stands for empathy. That is very, very important. If we are empathetic towards the patient, if the doctor or that team of the doctor, say nurse, nursing orderly, sweeper, etc., whoever is in the hospital, in the nursing home, if they are empathetic towards the patient, likelihood that most of the complaints will not be there against the doctor for the professional misconduct and negligence.
The event was followed with an intriguing panel discussion on the topic of organizations becoming the catalysts of change, uniting technology, medicine, and humanity in healthcare.
We are at the cusp of real exciting possibilities in the years ahead in healthcare. You have been hearing a lot about healthcare since COVID. Digital intelligence, automation, themes like artificial intelligence is unifying this entire healthcare, fusing different parts of the healthcare systems together. The clinical side, financial side, supply chain side, education, governance, provisioning or delivery of care is reaching past a point of convergence, with the patient being at the focal point of this unified supply chain. Growing evidence from India and globally shows that building an integrated healthcare system is the only way for us to wave off some of the massive challenges facing ahead, like, for example, the NCD burden. It's estimated it's a $6 trillion burden on the economy in India in the next 10 to 15 years, a huge, huge burden ahead.
It is trying to bring one structure for the entire country, right from a large hospital all the way down to a small clinic. That actually is the vision. How long it'll take to achieve that, it's not going to happen in a year or two. It may take a decade. But if we start on that journey and everyone is on that same pathway, and from that large highway, little roads are taking off, I think it is possible.
So the core point is that you require manpower, And over a period of time, like over the last decade or so, there is a mushrooming of, say, best healthcare system. I'm not talking of best healthcare, and I don't know why in hospital, not only in healthcare sector, not only innovative idea, but a lot of good hospitals are coming now. And the service, and they are providing services, tertiary care services in specialties. Whatever is available outside the country, that is available today in the country.
Every third doctor is an Indian, probably every second engineer is an Indian, and probably every sixth patient is an Indian patient. And so I think that's the lay of the land which we have to solve for. Now, over the past very many years, there has been substantial progress, whether it is from policy standpoint, whether it is from the standpoint of how the market and the industry has developed to be able to actually meet the needs.
We collaborated with the Maharashtra government and with the local district officers, wherein our teams are going every week to the interiors of Maharashtra, conducting camps and bringing these children to the hospital for surgery, because pediatric cardiac surgery is a very rare commodity. There are not too many people who do it. So through the RBSK scheme, which is the government scheme which is funding these children, including everything right up to the train fare for them to come. So these children actually have access to come to a hospital like Kokilaben, which otherwise would not have been possible at all.
The event was followed by an ice-breaking segment by Rajat Jain, founder, Spandan ECG, Sunfox Technologies.
Imagine a heart attack happening every time you refresh your Instagram feed, and that's the reality in India. And if heart attacks were a cricket match, so probably we would be scoring centuries every minute. And still, we don't see anything around us solving these problems. And after COVID, we have seen a recent trend that this is impacting the younger population. And nearly about 50% of heart attacks are happening for the patient who are under 50 years of age. And 25% of heart attacks are actually for the patients who are under age of 40. And we are also seeing, huge increase, about 25% increase in the heart disease among the young adults, especially after, the COVID.
Delving into deeper thoughts of healthcare, we had a fireside chat on the topic Humanizing Your Brand, building a brand putting compassion at the center of patient care.
I mean, healthcare is all about humans, isn't it? It is the least understood of the machines which we are born with, both in disease as in health. We are able to send people to the moon and Mars and send them, not Mars so far, at least to the moon and space and bring them back. But our collective knowledge of the human body, both in health and disease, remains rather rudimentary.
Healthcare is one of the industry where we are not happy at the time when making a payment. So if you look at any other industry, while you're buying a product or a service, you are elated, or rather have a feeling of what I'm paying has a tangible, happy benefit to me. But it's one place as a healthcare, as an industry, it's one place where we don't find that kind of synergies to a very larger extent of the majority of our engagement with the healthcare brand. Thus, it becomes very important. And the second biggest aspect becomes you're under a lot of pressure when you're making those decisions. Which, where, what healthcare brand that you need to work on. Now, if you look at these 2 pointers and figure out that it's very important for somebody to have a very long-term engagement, and engagement only comes in while you're building a brand for the long term. Thus, I think it's the most critical aspect of brand building should be healthcare as P0.
There is a lot that we carry along with us when it comes to trust and credibility over the years. What started with the light bulb is today a healthcare brand that people believe will hold the same standards that it has over the years with all its products.
At Omron, we have 3 buckets of our strategy when it comes to the holistic marketing. Number one, that how we can create overall awareness and education about home monitoring, not only for the patient, but also for some of the caregivers, healthcare practitioners, because KOL's recommendations plays a very crucial role when it comes to the decision making.
The event was followed by the unveiling of a coffee table book for Best Healthcare Brands 2024.
Let us hear a round of applause as we now present to you Best Healthcare Brands 2024.
The event was followed with a coherent research partner presentation.
Directly coming over to the research methodology that we have adopted, as rightly mentioned by our host here, we have a data triangulation approach wherein we undertake secondary research, primary research, and the CMI know-how. What we mean by the primary research is we talk with a lot of industry experts, veterans, opinion leaders across the value chain of the industry to understand what are their opinions and perspective about the new developments happening in this industry. Along with that, the secondary research or the desk research helps us understand the number of data sources, paid subscriptions that we refer to, gather insights on market dynamics, the competitiveness in the industry. And lastly, by accessing our in-house capabilities and industry analysts, we come to the criterias, and set criterias are defined to finally evaluate the top leaders and the brands in this market.
It was now time for the felicitations for Best Healthcare Brands 2024. Care Hospitals was felicitated as one of the Best Healthcare Brands 2024.
The evolution of the healthcare industry in India is primarily driven by 2 factors. First being the customer experience, and second being the clinical outcomes. While these are not in the chronological order, but the fact remains that a combination of these 2 always give an edge to the service provider and are being chosen by the customers over others. Thankfully, in India, there are multiple players who are doing so well, primarily because they focus on these 2 levers when it comes to the healthcare business.
The next brand to be felicitated was Dr. Lal Path Labs.
The 3 key factors that are driving the evolution of healthcare industry in India today, I would start with the personalization of medicine, whether it is in diagnosis or in terms of treatment. Second is usage and adoption of technology in various factors of healthcare delivery, including AI. And lastly, the whole consumerism wave that we are seeing, driving wellness as well as patient centricity in healthcare delivery mechanisms.
The next brand to be felicitated was Hamilton Medical India.
At Hamilton Medical, we envision a future where healthcare in India reaches new heights by ensuring that critical care is accessible in every corner of the country. We proudly support the 10-bed ICU project throughout several rural Indian states by providing our ventilators and intelligent ventilation modes that help bridge the gaps of trained staff at the bedside. The country's appreciation for innovative technologies inspires us every day to further develop superior products tailored to this important market. Together, we can transform healthcare for all.
The next brand to be felicitated was Kokilaben Dhirubhai Ambani Hospital.
Well, the medical profession was always something that attracted me, simply because unlike any other profession, this was one thing that was dealing with human lives, where you were actually making an impact, saving human lives, and to be able to touch lives, to be able to bring happiness in the lives of people. I think that kind of raw emotion you will not get to see in any other profession but medicine, and that's what drove me towards this profession. One of the main things that we do at our hospital is taking care of children who come in with heart defects, children who come in with hearing difficulties. Now these children, they come in from the interiors of Maharashtra or some other states who otherwise would not have had access to healthcare. But through various corporate social responsibility schemes, we are able to not just bring these children to the hospital, but make sure that they get their hearing back, make sure that they get their hearts fixed. And what can be more satisfying than changing the lives of children? These children who otherwise would not have lived for more than 5 to 6 years, they go back into the community as normal individuals, and to be able to give back to society is something that is absolutely touching for all of us.
The next brand to be felicitated was Ujala Cygnus Healthcare Services.
At Ujala Cygnus Healthcare, our vision and foundation has been focused on affordable and quality healthcare. Due to our lean cost model, we have been able to be torch bearers of the Government of India's Ayushman Bharat scheme. In fact, the NHA is right now focusing a lot on value-based healthcare, where a ranking system is being developed to rank patients and hospitals based on the value-based care parameters, that is outcomes and quality.
The next brand to be felicitated was Sagar Hospitals.
The rise in health awareness among the population is quite significant now. People are more informed about their health, leading to a higher demand for quality healthcare services. And third, the government initiatives and policies such as Ayushman Bharat are playing a crucial role in making healthcare affordable and accessible to all.
The next brand to be felicitated was V-Care Hair and Skin Clinic.
On a broader context, and as well as the aesthetic industry is also considered, there are a few things which are more important. Rather, I would say that advanced diagnostics, a lot of importance is required for the diagnostics, which helps in giving a very successful treatment to the patients. And second, I would say that introduction of newer technologies, maybe related to aesthetics, introduction of treatments at cellular level, cellular regeneration techniques, nanomedicine. These advanced technologies will help a lot in providing a meaningful solution to various disorders.
The next brand to be felicitated was Zeal Medical.
So there are various government initiatives such as the Ayushman Bharat, which aims to provide the health insurance coverage to the millions of people and is very significant, impacting the healthcare accessibility and the affordability. Now we also talk about the demographic shift. Now if you see the demographic profile of India, the increasing population of youth and the increasing population of the elderly patients also demands for a very good quality care.
The next brand to be felicitated was Zimmer Biomet.
We at Zimmer Biomet are global pioneers in robotics and AI-driven dynamic intelligent technologies such as ZBH, which has the power to elevate and unlock the full potential of latest digital technologies, robotics, and implant solutions. ZBH technologies, they collect objective data before, during, and after surgery, and then deliver actionable insights to help the healthcare professionals make the most informed decision possible.
The next brand to be felicitated was Supradyn.
The consumer today is highly informed and is looking for products that are tailored for their needs. We now need to make sure that we are listening to their spoken and unspoken needs and delivering solutions that are the best in class for them to manage their self-care. And this can happen by combining science, technology, and creativity along with the consumer insights. This to me will be truly the change, the step change in self-care management in the years to come.
The event was followed by Chief Guest Address by Srimati Dr. Anam Visala, Joint Drugs Controller India, Central Drugs Standard Control Organization, Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India.
As a regulator from CDSCO, the National Regulatory Authority, we regulate both the space of drugs, biologics, including medical devices. So what we do is implement the quality standards, and it's really heartening to see that today the Indian pharma has come of age. We as Indian pharma have noticed that we export medicines, as you all know, to more than 200 countries. Vaccines we do export to major regulated countries, and majority of our exports to WHO. Today, we have built in our capabilities in the biopharmaceutical space. We produce affordable medicines, and I'm also happy to tell you that CDSCO has recently approved the first CAR T-cell therapy in India, and it is nothing but a great achievement from the Indian scientists and coming from IIT Mumbai. It is the humanized CAR T-cell, and it's affordable at 1/10 of the cost. Apart from this, we have seen that APIs, key starting material, drug products are exported to as many countries that I just spoke of. Indian manufacturers have opened their facilities in US and Europe, and today they have spread their wings across various nations.
The 7th edition of ET Now Best Healthcare Brands culminated on high-voltage discussions, pride, and a sense of achievement. Though the curtains came down, but the search for excellence by the Times Group will go on.